Hi everyone, I'm Sarah. I'm Vancouver Island Regional Coordinator with Autism BC. And today we have Dr. Duff with us to talk about psychoeducational assessment, or as they're otherwise known as Psych-ED. So thank you for being here today. And if you don't mind doing a brief introduction.
Yeah, thanks. Thanks for inviting me. Right. So I'm a psychologist. I work in private practice here in Victoria in BC. In the past, I've worked in children's hospitals. I've worked in rehabilitation centers, but now I exclusively work in private practice. And most of the clients that I see a range of ages. So I see kids as young as 4, all the way up to older adults. In my practice, about 80% of what I do is psychological assessments, and psych-eds are part of that. I also do assessments for autism for adults.
That's great. So what does a Psych-ED cover and how is it different from an autism assessment?
Right. So if they're all kind of under the umbrella, they're all related to each other under the umbrella of psychological assessments. And so assessments, their purpose is to answer questions that somebody has either about themselves or about someone that they're taking care of or that they work with. And so a more broad psychological assessment will answer a wider range of questions. An autism assessment is a very specific kind of assessment that's answering a very particular question. Is someone or someone not autistic? Then the psych-ed assessment is also specific to how somebody's mental abilities might impact or play a role in what they do at school.
So how would you know if your child needed a Psych-ED?
Yeah, the big thing, so probably the most common reason is a teacher has suggested it. And that's because psych-eds are mostly used by parents and teachers. And they're used by parents because the whole purpose of the assessment is not only to answer the questions that you have about a child, but also to be able to give you answers about what to do about what the challenges are that they're facing. But my general advice for assessment, and that includes psych-eds, is if there's something happening for your child and it's making it hard for them to be successful, either at school or with friends or in other areas of their life, and it's not clear what you should do about it. That is, you've tried some things and they haven't worked. That's usually when an assessment's a good idea.
That's great. And would someone need a referral for that?
No, for a private assessment, you can self-refer. So you just call a clinic like ours and ask them if they have availability. There are some assessments that are available through the school systems, and these are usually done by a school psychologist. So a school psychologist is a teacher who has received additional training in how to give some of the psychological tests that we give. And they're also trained to interpret those tests. And so some school divisions they employ school psychologists to do these kinds of assessments. Those assessments usually only answer specific questions around learning style. So they're able to say whether or not someone has a learning disability, or if someone is intellectually gifted, that means they have very strong intellectual abilities, or if they might have an intellectual disability. So that's where they have a hard time learning all different kinds of things and they need more support than other kids their age.
And could someone get a designation from having a Psych-ED if they didn't have any other diagnosis?
Yes. So what you mean by designation is the Ministry of Education in BC, which takes care of managing all of the education that happens in our province. They set very specific criteria about what kinds of challenges kids can be experiencing that schools can identify and tell the ministry they need extra support for the school for these particular kinds of challenges. So that's sometimes called a ministry designation. So the kinds of designations that come from receiving a psychoeducational assessment could possibly be for a learning disability or an intellectual disability, also for some medical conditions, and for really severe mental health challenges. So that's like really severe depression or anxiety, for example.
Right. And what age do you suggest this for? Is there a time when a parent could say the child is too young, or?
That's a great question. Yeah. And sometimes I think, unfortunately, schools advise waiting a bit too long for assessments. So the question is the answer is a bit nuanced. So we have to be kind of careful about it. Depends on the kid, but there's always the balance between doing the assessment early and not catching what we mean to catch, because kids' behavior can be very, very different and still be normal the younger that they are. So I always use the example, like it's normal for a toddler to run out into the street, but it's not normal for a 20-year-old. So when kids are quite young, it's hard for us to figure out what might be actually a challenge, what may be a difference, a significant difference, like a learning challenge. But then if we wait too long, then we won't be able to identify something soon enough to get effective help. So that's especially the case in learning disabilities. Most of what we know in the research on what's most helpful for addressing learning disabilities, so that's a specific weakness, learning one kind of information or learning in one kind of way rather than other ways, is we know from research that when we catch, say, a reading disability early, and we do the right things, like in grades 1 and 2, then they actually end up not really needing extra help as they get older. So
That's right.
Yeah, it's a long answer to say, I don't think any sooner than kindergarten is usually necessary unless they're really having a hard time, but we don't want to wait until grade 5.
So if a parent was bringing their child in for assessment, is there anything they should do to prepare?
No. The only thing you really need to do to prepare would be to try to get any kinds of reports you have from previous professionals. So if you've seen a speech language pathologist and they've given you a report after working with your child, it'd be great to track that down. It's also a great time to try to get together all of your child's report cards and any other documentation you might have about your child. There's nothing you can do to help them prepare or to practice.
And can you tell us a bit about what the assessment actually involves?
Yeah, so we're usually like a little bit secretive about what we actually do. And the only reason for that is because if you or your child knows what they're going to do in advance, it can affect how you behave. And then we won't necessarily be measuring what we're trying to measure. But broadly speaking, in a psychoeducational assessment, depending on who's doing the assessment, you're always usually going to be taking some measure, a test. We usually don't like to use the word test because then some kids think it's like a test at school, and it's not. But we give it a test or a measure that's intended to measure problem-solving abilities. And the reason we do that is because when we can take a guess at someone's problem-solving abilities, we can actually use that to predict or take a good guess at how they should be doing academically. So where their academic skills should be. The second one that's almost always given in a psych ed is an academic test. So this is a really broad skills test where we look at reading, writing, and math, and all the little bits and pieces that make up those skills. Other practices, like in mine, I typically don't do assessments, psych eds, where it's just looking at those, because that will only let me say if someone has or does not have an intellectual disability or a learning disability. It doesn't tell me why they're struggling if those things are not the case. So you can expect also for a child to be doing things like questionnaires when they're old enough about how they think and they feel. And then you as a parent would be doing similar questionnaires about how you perceive your child's behavior and emotions. And we often ask a teacher to give us some feedback as well. So sometimes we'll speak with the teacher, other times we'll just send them questionnaires.
And then would that be followed up with like a written report?
That's right. Yeah, that's usually the last appointment you have is you meet with the psychologist. The psychologist will explain to you the results, give you advice about what to do about it, and then provide you with a written copy of a report. Now, we have certain standards that we have to follow to make sure the information is presented in a certain way.
That's great. That's all I have for today. So thank you so much for joining us, and that was really helpful.
Great.
Thank you.